This is just a portion. I mean, in every Cath Lab, you'll find that upon installation. Each cabinet is identified, and the system identifies the room and the cabinet where it's at. You can locate every month or every day, you can locate soon-to-expire products or expired products. They'll show up in red, and they'll tell you exactly where they are. Also, at the XPOS stations, at the point of use stations, if you try to scan a product that is expired, it'll show up in red, and it'll actually make a sound, so you do not use this product. It's kind of like another warning, so you do not use this product on a patient. There goes, this is the 750,000 that we've maximized on bulk buys in about 8 months. By using that, I gave you guys a little bit of a perspective on how we use it. We pick the ones with the highest usage, and we bulk off of those. We usually do a 4 to 8 week bulk. We store them into a central warehouse, and we monitor all the products that we own versus everything that's consigned. It's helped us reduce write-offs, reduce inventory, and only purchase those items that are high turnovers that we are guaranteed to use. So we do not, manufacturers as well as us here, we benefit. This is a win-win situation because they're not shipping me products that they're going to have to, if they're consigned, take back and actually have them expire or waste. Sometimes after they've been shipped back, regardless if they're used or not, they're actually trashed. So it's a waste for both departments. It's hard for us to manage, and it's hard for them to have all this waste. So it's kind of a joint managed inventory system where we can both maximize on what products are actually high turnovers and money makers for both of us. Go ahead, Quentin. So some of the benefits, there's a lot of benefits, but we tried to point out the key ones is improving physician relationships. That's first and foremost, because when physicians have the tools they need, they're not aggravated by not being able to perform their procedures or having unsatisfied results, because they have on hand what they need on a daily basis. We reduce and eliminate any item that's on the shelf that that we run out of inventory. It's kind of like the same thing, improving for the physicians, giving them the tools they need. We have the right product when we need it, not all the time, so we're not overbuying. Expiration and patient safety, being able to track expired products and improve on what we're going to do with them before they expire. We do requisitions on real-time information, not on guesses or boxes that people are storing in a room telling us what they thought they used or what they didn't use. And it also provides an audit tool for billing. Here at our institution, we don't use it for billing just yet, but it does give us a track of how much we spend on a weekly, monthly basis for each product. Future goals for Florida hospitals. We have been decentralizing our elective PCIs. In other hospitals, our first pilot is Altamont, where we do a few procedures, but we haven't been doing elective PCIs. We just deployed our Wavemark cabinets in this hospital. We're probably going to be going live at the end of July, probably August, if all goes well. And we'll be able to manage all of our purchases from one location, from our main hospital, to be able to assist them in ordering, assist them in smart buys, and track the products that all of the hospitals together use, and at the rates we use them, so we can be consistent. We also want to expand to the barcoding solution for everything that's not registered with Wavemark today, so we can continue to make efficient purchases and we can streamline our product lines. We want to implement Wavemark where it does automatic reorders for us. We have to add a couple of interfaces so the replenishment product is less manual. We're still a little you know, we're still a little old-fashioned that way. We do a lot of the stuff ourselves, but at the same time, we're getting to the point where we're trusting what we see, so the interfaces are being designed. And we're implementing ways on how we can reduce waste and make sure that we don't lose items that are not being charged for. So that's how Wavemark has helped us today and some of our future goals. Go ahead, Quentin. In conclusion, for all of you, the richness of information that is enabled by Wavemark has helped me as a supply chain director, as well as the hospital, focus on patient satisfaction, physician satisfaction, and overall supply controls, where we are not being careless about what we purchase. It's also given us the tools to see which items are more important so we can continue improving cardiovascular medicine. It's been great for us. We're really happy, and we're continuing to learn every day on how it can help us be better. That's it. This is my email address. As Quentin put in red, the number 2, there's a few Margarita Riveras at our hospital, so I'm Margarita Rivera 2. Margarita Rivera 1 is tired of sending me all my emails. And if you have any questions, I'm ready for you.
Great. Okay. Thank you. We do have a number of questions. So the first one, what was Florida Hospital's ROI for the Wavemark program?
Well, that's a good one because I wasn't here when they decided to implement Wavemark. Wavemark had already been here for about 1.5 years when I arrived. So I don't have the complete analysis that was done to implement the program. But since I've been here, just an example, I've been here since September of last year. We were in the red, probably about $2 million when we started using it to our capabilities, and we're probably in the black almost $1 million, and it's only June. So it's really helped us. I'd have to start tracking the return on investment, but still a ways away.
Okay. Do you use separate cabinets for hospital-owned versus consignment inventory?
No, I do not. I actually have, what we do is the Wavemark system actually gives you a place where you allocate what is consigned. For an example, if it's balloons and you have 200 balloons on the shelf, you can actually tag which types of balloons, which manufacturing line, and the quantity. So it'll automatically recognize how many are consigned and how many are owned. And it'll give you that dollar amount. So I just manage consigned levels.
Do you expect to expand the Wavemark program to other hospitals in the IDN?
Yes. Like I said, we just rolled it out last week. We implemented our first set of cabinets in Altamont, which is our second hospital in the IDN. If this one goes well, this pilot, we actually have it in 2 departments here in our hospital, and now Altamont. And the future goal is to move to Florida Hospital East, and then Florida Hospital Celebration would be next in line if all goes well with this pilot. And the good thing is I'm able to see it all from here.
How long did it take to implement?
Like I said, I apologize for not having all these details. I believe the implementation process took probably 3 weeks, I would suggest, with the cabinet setup. Now, the Altamont implementation, which I have been part of, we wrote the contract, we scheduled the date, and they implemented and installed the cabinets in 1 day. We registered all the products that same day, and they're a lot smaller than we are, though. And we were training the staff on Monday morning. It was done on a Sunday, and that was last week, and they're up and running now. So it took 2 or 3 days. Our lab was a lot bigger, though, and to register everything and track it.
Let's see. What would you change in the system?
What would I change? Well, some of the reports that it gives me are good. I would make them a little bit more automated if I could tailor them a little bit more. There's some analytics in there to make decisions at a higher level for contracting. I would like to see a few more. I would also, this is not really a change. I would like to have more manufacturers be part of this because when they are pre-registering the products, it simplifies our process, and they're able to view our cabinets and shelves simultaneously, so they can predict what I need instead of guesstimating based on experience or whatever their decisions are when they introduce new products.
Have there been any system outages or instances where the system is temporarily out of service?
Not since I've been here. We've had a couple of the XPOS stations, which are touchscreen monitors. They might have glitched a little bit, but we'll have a new one the next day installed. They ship them overnight, and we'll have a new one in the store in the room. But nothing that's gone out that we haven't been able to use. No.
Do you maintain the same inventory item in different cabinets within either the same or different stock rooms?
That's a good question. We tried a couple pilots where we had a couple of units in some of the rooms. I actually have one vascular lab where I have a cabinet where I have duplicated items in my stock room as well as the room. It duplicates your inventory some, so it's not efficient. We have a main stock room, but we are doing a pilot where we are putting our guides, which are the bins with the tall boxes. We're putting the most common guides in a room to track efficiencies on speed and having the tech leave the room. So there is a possibility that we will put some guide cabinets in the room, but balloons and stents and everything else, which has to have so many sizes and so many SKUs, it's something that it's not virtually impossible, but we're not looking forward to doing it. And the system will also give you room restocking suggestions so you can actually see which each room uses. The room that we put it in is actually one of our busiest rooms, and we track a couple of times a day what's been pulled out so we can restock efficiently.
How does the reorder route to materials management?
Well, currently, for our hospital, as I said, we're a little old-fashioned, so we don't have the interface that writes directly from Wavemark into our system. That's a lot of red tape for us to let go of. But we run a replenishment report out of Wavemark, which has all of our data, all of our manufacturing ID codes that we use internally. And it gives us, based on usage, what we need to order, and then manually we just input that order every day.
How do you deal with suppliers who are not part of the program? Do you have a segregated inventory?
No. We tag and register ourselves. And those tagging stations that you saw during the presentation, we will register it ourselves. It takes up a lot of our time, and the manufacturers that know me well know that it'll be part of our contract negotiations next go around. It's very important that we have some efficiencies.
What are the benefits to suppliers for this technology in Florida Hospital, and are the RFID costs shared or supported in total by Florida Hospital?
I don't know the supplier costs. I can't tell you exactly. I know there's an initial setup cost to the supplier, but the benefit that I see for the supplier would be that they would be able, because the supplier does have to have a bag of goodies